in a conference call with 47 of America's governors. We were able to brief them on the latest, the progress that we've made. We were able to confirm with them that testing is now available in all state labs in every state in the country. Over 1 million tests have been distributed before the end of this week. Another 4 million tests will be distributed. But as I said before, with the deployment of the commercial labs, we literally are going to see a dramatic increase in the availability of testing, and that's all a direct result of the president's leadership. Today, in a few moments, we will outline community guidance that Dr. Birx and Dr. Fauci will be publishing. The President's direction, we're going to be providing guidance about how to keep your home safe, how to keep your business safe, how to keep safe and healthy at your school, and we'll be publishing that information and speaking about that. A brief word about the Grand Princess. The Grand Princess has docked this afternoon in Oakland, California, at a commercial dock. 25 children, we were happy to learn through the screening over the last 2 days, the 25 children on the ship are all healthy. Of the people that have contracted the coronavirus, 21 in all, they're being dealt with in proper isolation, working with health authorities in California. We hope before the end of today to begin to disembark California residents to Travis Air Force Base and Miramar. We've made arrangements with Canada and the UK to take their passengers back. They'll be transported directly to the tarmac, charter flights home. Tomorrow, the remaining passengers will be transported again through very, very carefully controlled environments, buses, out to the tarmac and flown to military bases in Georgia and Texas. All the passengers will be tested, isolated as appropriate, quarantined as appropriate, and I want to express appreciation to the Governor of California and his administration, the Governor of Georgia, the Governor of Texas for their strong cooperation with us in resolving the issues around the Grand Princess. It has been a partnership which the President directed us from the very beginning, and the process that Bob Kadlec will detail in any questions in a few moments continues to work and move forward. The remaining people on the ship, the crew itself, will push off from the dock, and they will be quarantined and observed and treated shipboard. But the President made the priority to get the Americans ashore, and we're in the process of doing that, as well as returning foreign nationals. Let me just say one other point, as the President has spoken today to congressional leadership. One of the things that I informed the President that I've been hearing from governors is the concern about hourly wage earners in this country feeling that they had to go to work even if they were ill. The President has tasked this economic team and is working already with leaders in the Congress to make sure that anyone feels that they're at risk of losing their job or losing a paycheck because they may contract the coronavirus. When we tell people, if you're sick, stay home, the President has tasked the team with developing economic policies that will make it very, very clear that we're going to stand by those hardworking Americans, stand by those businesses, large and small, and make it possible for us, as the President said from the very beginning, to put the health of America first. We'll be available to take any questions on any of these topics, but Mr. President, I didn't know if you wanted to speak.
Well, I think what we will be doing is having a news conference tomorrow to talk about various things that we're doing economically. They'll be very major, including obviously the payroll tax cut. And so we'll be meeting again tomorrow afternoon. We'll be coming back from the Senate. We have a lot of very important meetings set up. And we'll have a press conference sometime after that. and we'll explain what we're doing on an economic standpoint and from an economic standpoint, but they will be very dramatic, and we have a great economy, we have a very strong economy, but this blindsided the world, and I think we've handled it very, very well. I think they've done a great job. The people behind me have done a great job, so I will be here tomorrow afternoon to let you know about some of the economic steps we're taking, which will be major. Thank you very much.
We have been listening there to the president's appearance inside what has been a new daily tradition at the White House. The White House, by the way, that often does not use the press briefing room for daily presentations of any kind. Mike Pence taking questions. Let's go ahead and listen in a little bit and see if there's any news, made.
Somebody who had the virus.
Let me be sure and get you an answer to that. I honestly don't know the answer to the question, but we'll refer that question and we will get you an answer from the White House physician very quickly. Let me ask Dr. Fauci and Dr. Birx to come to the podium. You all and the American public will have at their fingertips very quickly guidance that this is for every American. We're working with communities like the Seattle area, or like portions of California, New York, and Florida that have what we call community spread, a concentration of coronavirus cases. But we directed our team to come up with helpful recommendations for every American family, every American business and school. And if Dr. Birx and Dr. Fauci step forward, they can outline that for you.
Great, thank you. Good evening. It was good about getting out last week, meeting with communities. We know that the real solutions to this is every American has a role in stopping the spread of the virus. And so we wanted to really put out guidance for every American and every community that was practical and common sense, but detailed in a way that everyone would know precisely what to do. The guidance will be around how to keep workplaces safe, how to keep schools safe, how to keep the home safe, and how to keep commercial businesses safe where people would eat or be present. The importance about this is we believe that communities are at the center of this. I came from a field where it was the communities that really solved our issues around HIV prevention. And so we're very much speaking to the communities and the American people about what can be done. All of this information came from a paper that Dr. Fauci provided from the Australians, first author Dalton. So you can actually look up the scientific evidence that informed each of these guidelines, but we will be providing that this evening in great detail so that every mother, father, child, son, daughter, caregiver will know precisely what to do and what to ask for.
Dr. Fauci?
Yeah. Just to reiterate what Dr. Birx said, it was as simple as that. We have been speaking about the kinds of things that would keep our citizens safe in a variety of environments. We've been speaking about on telephone calls, we've been speaking about at conferences. The CDC has been talking about this for a long time, as has Dr. Birx and I. So we thought we would put it together in a neat-formed way that would be available to the general public. What Dr. Birx had mentioned is that just the other day I got one of many, many emails where some of my colleagues that I know from Australia actually decided they were going to write a paper on it and make a number of boxes, which was exactly saying what we had been talking about. So we came up with the idea it would be very good for clarity. So why don't we just put it together, edit it a little, and put it in a way that people can look. What about the home? What about the school? What about the workplace? These are really simple, low-tech things. There's nothing in there that's complicated, but it's just stated in a way that's clear that people can understand.
I might ask the Surgeon General if there's anything about the guidance you want to reflect on.
Well, one thing I want folks to know is that we have been looking at the data from around the world, and we now know more than we ever have about who is at risk. Who is at risk, and I hope you will help us communicate this to the American people, are people over the age of 60. They're much more likely to develop complications from the coronavirus and to be hospitalized from the coronavirus. The average age of death is age 80. Now, what we also want communities to know is that if you are a child or young adult, you're more likely to die from the flu, if you get it, than you are to die from coronavirus. So there's something about being young that is protective. We want people to be reassured by that. We want people to know that we are really focusing in on those groups that are at highest risk for complications and helping them understand how to be safe. And this new advice that's going to be coming out tomorrow is designed to keep our community safe, to help keep the most vulnerable safe. And it's important to understand that even though young people aren't at risk for dying from coronavirus, they can potentially spread that to older people in the communities and people with chronic diseases. So it's important we all take precautions, washing our hands, covering our cough, keeping our distance from people who are sick, and taking the steps that will be coming out in this new guidance to help make sure we're doing everything we know possible to keep our most vulnerable protected.
Great. Well done. Thank you.
We have been listening to the ongoing coronavirus briefing at the White House. As mentioned, the president spoke, Mike Pence spoke.
So that's, I don't know, it's concluded. Let's see if I can find the rest of it on C-SPAN, because it is quite valuable information. And fortunately, there is this tendency for, excuse me,
please stop saying everything's good.
there's this tendency to pull away from something just because it's, you know, a bit too long. And now I'm trying to determine if it is continued on C-SPAN here. And one moment, I'm going the wrong way here. There's, let's see here. U.S. Senate, U.S. House Representatives, see if that's it. And, yeah, hold on a second. Looks like it is. It is.
But with regard to seniors, I might just ask Seema Verma to step up and speak about. Last week at the President's direction, we raised the standards for every nursing home in America with regard to infectious disease, and we are deploying all 8,000 of our inspectors in every state, as we told the governors today, to focus exclusively on infectious disease compliance at our nursing homes. Our hearts break for the families at the Kirkland Nursing Home in Seattle. The loss of life has been grievous, but we are sending the message out, working with our governors to make sure our nursing homes and long-term care facilities have the additional layer of protection against the spread of the coronavirus. And maybe you'll give us
Thank you. Thank you, Mr. Vice President. As he said, that's exactly where our focus is. It's around infection control. We're working with the entire healthcare industry. Today we issued more guidance to nursing homes about really upping their screening of people that are coming into the nursing home and making sure that, you know, they're gloved and they have masks so that we can protect people that are in the nursing homes. The other thing that we're doing is, because we know that many of our senior citizens are vulnerable, we want to make sure that they know that the Medicare program is behind them and we're here to support them. We're letting our patients know that they can get a coronavirus test and that there is no cost sharing associated with that for our seniors on the Medicare program. And we're also letting them know that because of the President's leadership, over a year and a half ago, he took action to actually extend more telehealth benefits to our nation's seniors. And this is a very historic change that we made under the President's leadership. And so if they're sick and they're ill, they can call their doctor, they can Skype with their doctor, and Medicare will reimburse for those services. And we've also, in our conversations with governors today, we've talked about having telehealth services also available in the Medicaid program.
Great. Let me invite Bob Kadlec, who is Deputy Secretary of HHS, to come forward as well to fill us in on the latest on the progress on the Grand Princess.
Thank you, Mr. Vice President.
That is dockside now and is going through a very careful process of having Americans and foreign nationals come off, and everyone will be tested.
Thank you very much, sir. And yes, we began our medical operation to basically disembark those passengers on Saturday. We placed a medical crew on that boat to augment the physicians and nurses that were already on the ship. We basically ensured that the quarantine on the boat and the isolation were being enforced, and then evaluated first the children and those who were ill, identifying anyone who is severely ill if possible. When the boat arrived on dockside today, additional medical personnel came on board and we began an orderly disembarkation. Our intent is to basically disembark about half of the passengers on the boat today and the other half tomorrow. And everyone will be medically screened before they get off. If there's any question about their physical or health, they'll be screened again more additionally. And then they'll be transferred to one of the 4 quarantine sites in the United States: Travis Air Force Base, Miramar Naval Air Station, Lackland Air Force Base, and Dobbins Air Force Base in Georgia. The foreign passengers will be transferred, the Canadians will be taken back to Canada, and we're working with the United Kingdom to return their passengers back to the United Kingdom. But we're doing this all in cooperation with the great support of the state of California, the city of Oakland, and with the support of the Department of Defense, Department of Homeland Security, and the U.S. Coast Guard. Thank you.
Great. And on the subject of testing, we had a very good discussion today, as I mentioned, with 47 governors, and outlined for them all of the different testing methods that are available. We have tests now in every state lab in America, but we're rapidly expanding that. And let me ask the Secretary of HHS to give us the latest on the availability of testing to the American public and to the states.
Great, thank you, Mr. Vice President. So we continue with our strategic plan at HHS across all of the components represented by many of the leaders here, which is to diagnose, to treat, to contain, to mitigate, to research, and communicate. It's what we do in a healthcare crisis situation. One element of that is the test, which of course CDC developed in record time after getting the genetic sequence posted from China. That then was available at CDC, and from that point on, there was no individual that a public health official needed to get tested. The CDC didn't have surplus capacity to test, but we've been moving progressively to bring that test closer and closer and closer to the patient and to the bedside, and to make it as easy as possible for us to use testing. Very much in line with our peer countries facing similar epidemiological circumstances. At this point, we, as many of you who were here on Saturday for the briefing know, we have over 1 million tests that have shipped from CDC and 2 private contractors that are the CDC type of test. Those are now out, and as the Vice President mentioned, every state public health lab is validated and operating those tests. In addition, hundreds of thousands of those tests are in hospitals, in private labs, in commercial labs. We now have a total of 2.1 million tests that are available, either shipped or waiting to be shipped or waiting to be ordered. We, by the end of this week, expect to be able to be producing up to 4 million tests per week in the United States. And that is on top of what the private commercial entities, the companies you know of like LabCorp or Quest, using their technology, the tests that they're getting out, which is an even better experience for the patient, because those work, they are able to actually collect samples directly in doctors' offices, have a very sophisticated collection system to their labs, again, making it a very much more seamless patient experience. They're now validated and getting up and running, and that you'll see even more of that. So as I said, over the next week or so, you're just going to see a progressively better patient and physician and provider experience connected to diagnostic testing here in the United States. Thank you.
Very good. Well, maybe questions in just a moment. We'll come back. We'll come back. With that, I want to invite the director of CDC to come forward just to give you an overview of where we are in the country with regard to cases, and then we'll take questions on any of the topics.
Thank you, Mr. Vice President. We do continue to see an increased number in cases. Again, as we said we would, as time passes. We currently have over 500 cases now in the United States, outside of the repatriation cases and the cases on the Diamond Princess. We now have cases in 35 states that have been reported in the District of Columbia. I want to reiterate what the Vice President said, despite what I just said here, is that at the present time, the risk to the American public does remain low. We do have several community outbreaks, which we're focusing on in the Seattle area, in the Santa Clara, California area, in Westminster, in New York, and in Florida. And these are areas that we're investigating heavily to try to understand the transmission mechanisms there and begin to help these jurisdictions begin to operationalize a series of mitigation strategies to help, again, to slow and contain the outbreak. Thank you.
And let me say, just before we go to questions, coronavirus.gov. For the American public, for healthcare professionals, it is a comprehensive website. We're adding to it every day. And also, Dr. Birx, we're working very diligently to establish a single website where people can go to track all of the cases and where they're emerging. Questions, please?
Can I ask you and Secretary Mnuchin, if I could, the
Yeah,
stock
please.
market, a huge slide today, and people are on Wall Street now talking about the possibility of a recession. Some people saying it's a better than 50-50 chance that will happen. How worried are you that will happen?
Well, let me just first say, today was an unprecedented move in the oil market. So, we saw a overnight reaction of over down 20%. And that's obviously what had a major component today on the stock market. But let me just make a couple of comments more broadly about the economy. First of all, we couldn't be more pleased that coming into the situation with the coronavirus, the U.S. has the most resilient economy in the world. You saw a very large economic jobs number last month, and we couldn't be more pleased that the president's economic programs of tax cuts, regulatory relief, and trade have put the economy in a very good position. I would also just say that I am in daily conversations with Chair Powell.
On this vote, there are 391 yeas. There are.
Okay, folks,
zero,
I'm
and
gonna
there
stop
are
that here
no-
because
no recorded.
they shifted. So that's the full televised press conference. Apparently, C-SPAN is showing to that point of being able to piece together from MSNBC and then C-SPAN a full press conference. The White House will send a transcript. Given the length of the press conference, I don't believe that transcript is going to arrive until tomorrow. Additionally, I will break out the piece that's on Oakland and the Grand Princess in a moment. Subscribe to Zenny62 on YouTube and bookmark oaklandnewsnow.com and Zenny62.com.